conference, we have Dr. Trong Chok Kwan from the Center for Health Protection and Dr. Lau Ka Hin, Hospital Authority's Chief Manager. Dr. Trong will first update you on COVID-19 cases. As at midnight last night, we have 11 confirmed cases. 7 are imported cases. For case number 5115, is arrival from India via Dubai on flight EK384. And then from 5116 to 5121, they arrived on flight RA4099 from Nepal. Now, many of them arriving on the same flight on the same day. So, therefore, we used CAP 599H and banned flights from Nepal for 2 weeks, starting from the 4th to the 17th of October, because there are more than 5 cases from the same place. And then apart from the 7 imported cases, we have 2 cases who were family members of 2 imported cases yesterday. These are cases 5124 and 5125. They have finished their hotel quarantine. They went to stay with a relative, but they became confirmed cases. For 5110, when we learned that it was a preliminary positive case, we arranged for these two to hospitals for testing because they show some symptoms and they tested positive. And then there's one case with some links to a previous case. It's a rather complicated case, actually. It's 5123. A 38-year-old female. She came from Thailand to Hong Kong in mid-March. She came to visit friends. So she stayed at a place together with other Thai friends in Hong Kong when she arrived. It's a whole building in Tsim Sha Tsui. According to them, it was about the 2nd of October. They learned that there were Thai travelers who were infected, so they became worried. And then they moved to a hotel. I think it's Stanford Hill View Hotel or something like that. And then they stayed with some friends. Some moved there, some moved elsewhere. And then we send these people to the quarantine center. And one is a preliminary positive case, because after testing, the results are preliminary positive. And for this preliminary positive case, is a 35-year-old. She has family members in Hong Kong, but for some reasons, she went to Holly Mansion to stay with her friend. On the 2nd, she moved to another place. And we found out that she went to with case 5111 to Wong Kong and Tsim Sha Tsui for shopping and so on. And then we that's 5111 actually. So we asked the 5111, she confirmed it, but for the information given previously, there was some mistake, and so we had some contact with the Thai authorities. Eventually, we found that this preliminary positive case is actually the friend that went with 5111 to go shopping. And they all stayed at the same building as 5123. We are still tracing one or 2 other persons. We have asked the police for assistance. Now, it's because they gave us some wrong information. We will see whether there's a breach under Cap 5990. If so, there may be a prosecution. And there's another case with a known source of infection. That's 5112, a 46-year-old female. She's clerical staff. She lives in her family members in Lam Ching Wan, Chingyi, Block 5, and then she works in Chitling Building. Now she just goes to work, to and from work usually. She doesn't go, she didn't go anywhere much, maybe just to, she just went downstairs to get food. She started to have a cough on the 24th of September and on the 14th of September. She went to hotel in Tsim Sha Tsui for buffet, and she said when she went to get food, she wore a mask. But we want to play safe. So for this hotel, Gong Wai Hotel, then we'll be giving out the Omni Marco Polo Hotel, that is, we will be distributing the specimen bottles. So that's all for the report today. Ms. Dr. Lau, please, on Hospital Authority. As at 9 a.m. this morning, in the past 24 hours, the Hospital Authority system recorded 14 reportable cases. In the past 24 hours, 3 confirmed patients recovered and were discharged. So far, 4,864 patients have recovered and discharged. As at 9 a.m., there are 117 confirmed patients in 17 hospitals. 11 patients are in a critical condition. 8 are in serious condition. The rest, that is the remaining 98, are in stable condition. As at 9 a.m., negative pressure beds, we have 1,131, occupancy rate 62%, and for negative pressure ward 633, occupancy rate 71%. Thank you. The floor is now open to questions. Please first identify the organization you represent before you ask questions. I'm from RTHK. About China Secret Bar. Can the CHP now confirm that the IFE student was at the same bar on the same night with that Thai lady? Did they come into any contact? And on that night at the bar, how many customers were there? How many have been traced, and how many you're still tracing? And then there are reports too that in the bar there were 28 customers at 7 tables, but according to existing legislation, there should be just 2 persons per table. So is the CHP aware of that? Do you know if there's any violation of the regulations? So will you pursue it? And also, are the premises covered by a restaurant license or a bar license? If it's restaurant license but they operated like a bar, then could you consider that a loophole, and would you have to review that? And then yesterday, there's a parent of a kindergarten student that's become a confirmed case in Chingyi. Is that so? And are there any preliminary positive cases at that Chingyi kindergarten? And then this morning, experts saying that we are seeing cases with unknown sources of infection for a few days in a row. That's probably, maybe there could be a surge in the epidemic. So do you need to tighten the measures? And has it to do with the long weekend?
According to information provided by the police, we have reason to believe that 5098 at the same night went to this bar. And of course his recollection of events is not that clear. And according to information on hand, that night there were roughly 20 patrons, not 28 as much as you said. And maybe the majority of them, 1 or 2 of them, are still missing. The rest of them have already been sent to the quarantine center. Now, regarding licensing, I'm not too familiar. You need to follow up with the relevant departments. You referred to a kindergarten. That should be the family members of 5111. The parents were not quarantined. It should be the most recent occasion. They sent the child to the school, the kindergarten premises. So we have not arranged for temporary closure of the school. The child is in the quarantine center. Now, the situation, as we said before, we have cases where the source is unknown, and we have some invisible carriers. That is, they have no symptoms, they have symptoms, but they refuse to seek medical help. So we might have different strains of the virus, and this could lead to an outbreak. When we follow up each case, it's like putting out a fire. But it is hard to detect these fires before they appear, and we can only urge people to maintain social distancing. You should minimize contact, and you should not put the community at danger. The speaker is not using a microphone. Initially, we knew there were some 7 tables, and in that booking, there were double bookings. In fact, there were only 6 tables of customers. So there were 21 customers, and we are still trying to locate 1 or 2 individuals. The rest have been sent to the quarantine center. Hong Kong 01. I'd like to ask, yesterday, the Qingyi, 27-year-old Thai housewife, has she worked in China's Secret part-time, and which day did she work? We also know that there are different bars near China's Secret. So does CHP know that the staff will work in these different premises, and in the bar outbreak, we've received news that patrons of China's Secret are confirmed cases, and they have also had meetings amongst staff members. So there are close contacts, and it seems that not all of them have been quarantined, and some of them are even going to work today. So will CHP give us the name of the pharmacy and the name of the bars, and how many people have been confirmed? Will you disclose that information? I also want to know 5123 that you announced today. Did she go to China's Secret? And the initially confirmed case, is that also a Thai citizen, and where are they located now? I don't have information indicating 5111 went to China's Secret. Just now you mentioned a lot of scenarios of people going to different premises and pharmacies. I do not have this information. You could provide it to us if you wish. 5123 did not go to China's Secret, and initial confirmed case, let me check my information. That patient went to Kimberley Hotel. I don't have the detailed address right now. TVB. We see that over the 4-day long weekend, there was an improvement in the situation previously, but are you worried that after the long weekend, we might have another outbreak on our hands? And I also want to ask, in March, there was a Thai national who came to Hong Kong. Could you give us more information? Did they go to Tsim Sha Tsui, or which places did they visit? And do you have any other contacts that you will try to follow up on? Yes, we are worried because we have crowded premises where people gather and there might be a spread of the virus. So initially confirmed cases, I don't have too much information. They have lived with case 5123. They stayed in the same locations, so they are close contacts, and some of them have been sent to the quarantine center, and some of them we're still trying to follow up. Ming Pao, I want to ask, case 5123, he had lived with Thai national friends in Tsim Sha Tsui, Holly Mansion. So are they related to the China Secret Group? And how many people have you been able to track down? Regarding yesterday's information, there was an 82-year-old male, case 5112. That person lives in the same place as the IB student. So the 52-year-old, is he the second generation patient from the bar group? What is his CT value and what is his antibody test? The outbreak group, has it expanded? Does it involve other people? Regarding the Qingyi Thai housewife 5111, her child's kindergarten has been suspended for 2 days. So the child is the child a preliminary confirmed case? The information we have on hand, 5123, had lived with 5 people, including the initially confirmed case, and 3 of them have been sent to the quarantine center, and 1 person is still being tracked down. 5112, I said that it is related to a previous case. It is a family member. 5111, the kindergarten, we have not recommended that they suspend kindergarten. The gentleman.
First of all, can I just clarify some information about 5123? When you were talking about her case, you said that someone has given incorrect information that the person might have violated CAP 5999. Can you just clarify who has given the incorrect information? Are you referring to the Thai woman you talked about yesterday, 5111? The second and third questions are about the Thai woman who have been to the China Secret Bar. Did you have more information about that woman? For example, was she working as an illegal bar woman at the bar, even though she was only a tourist? And do you know if there were other people who were also working as illegal workers in that bar? And the last question is about the difficulties in inspecting, bars like China Secret. You talked about how people need to have reservations to enter the bars yesterday. So I'm just wondering, were there any difficulties for the government to inspect, these private bars in the past few weeks? How many bars have the authorities inspected, and how many have been found to have violated social distancing rules? Thank you.
When tracing 5123, we noted that an earlier case, 5111, have given us false information. I have no information on whether 5093 was working or not, or whether it's legal or not. We leave it to the relevant authorities to investigate. I also have no information on the private bars and clubs.
You said that you contacted the Thai authorities about a Thai woman who has left Hong Kong.
Yeah, so that one is a false information.
So the woman still in Hong Kong, actually?
Actually, it's the preliminary positive case.
Next, Dr. Chong, I'm from Cable TV. For 5123, now she arrived in mid-March to visit friends. How come she stayed here since March? And have you got information what they came to Hong Kong for? They stayed here for so long. What were they doing? Did they go out to work during their stay, because they stayed for such a long time? And then for the preliminary positive case, is that Hong Kong resident or Thai national? Now, we're seeing infection spread by Thai. So is there a Thai transmission chain now? And then Dr. Chuang said for case 5111, the patient provided false information. So how can you prove that she's given false information so prosecution could be taken out? In that case, would she be the first prosecution of this nature? For 5112 and 5123. 5122 and 5123. Do you just count 5122 as the only case with a known source of infection? Would you count that for 5123 you have traced the source of infection? For 5123, the information given by the patient is that she came here to visit friends. But as we investigated previous cases, we know that for Thailand, they've actually stopped all commercial flights. So I'm talking about a previous case. So that's why they had to wait for the consulate general to arrange for them to return to Thailand gradually. But I'm not sure about the details. For the preliminary positive case, sorry, what was the question again? Oh, yes. She has family members in Hong Kong. And we are a bit worried because recently we've seen cases involving Thai nationals. It's possible there is a transmission chain, or maybe they've had gatherings. So we have liaised with the Thai consulate general because they may want to help us, say, distribute specimen bottles to those who want them. So for now, they are helping to distribute specimen bottles, and they say there are about 100 people going to the consulate general to collect the bottles each day. So let's see if that will help us to find cases. As to whether there will be prosecution, we have to seek legal advice and we have to study the case. For CAP 599D, I don't think this is the first case. I think, well, perhaps for us to do an investigation, this is the first case, but I believe there were other cases before under CAP 599D. So do you only count one case as with a known source today? For the 5122 case, a known source of infection. Now the patient lives in Qingyi, so is it possible that the case is linked to 5111 because the other for 5111 she also lives in Qingyi? Is it possible that they in fact they're related? And for 5122, I said that she is a clerical staff at Chit Lun building. So can you tell us which company it is? And would her colleagues be classified as close contacts? Would they be sent to quarantine? And for the 5123 case, now the lady has stayed at the Holly Mansion and Stanford Hillview Hotel. Can you give us when they were there? And at Stanford Hillview Hotel, did she stay with the other five persons, or just one or two friends? Now she stayed with 5 persons. You've sent some of them to hospital. For the rest, where are they? Are you not able to track them down, or are they trying to hide from you? Now for 5111 and 5122, they both live in Qingyi, but we haven't found any links yet. They haven't been to the same place, but of course, if they just happen to pass by each other on the street, there's no way to find out, and there's no point really. For 5122, place of work, I gave you the building name. There are about 40 co-workers. We've given them specimen bottles, and there's one colleague who sits closer to her during lunch, but actually they do work quite far apart with petitions. But anyway, we send that one colleague to this quarantine center. Now for 5123, she moved to Stanford Hillview Hotel on the 12th. She went with 3 others, and for the last one, the 5th one, she moved somewhere else, and so we're still trying to track her.
could you just clarify whether case 5098, 5111, and 5123, and one of the preliminary positive case today, are they all linked together? Do they know each other? And also, you said that case 5111 provided wrong information, and you're considering prosecuting her. Can you just clarify what sort of information that she provided that you think may be invalid? And also, there are 6 cases, imported cases from Nepal today. Do you think that this shows that the screening process there has not been stringent enough? And what more do you think the government can do to improve that? And also, how would you assess the virus situation right now, as some experts are worried that there may be a 4th wave coming with a number of unidentified cases? Thank you.
5111 and the preliminary positive case know each other, and they went out shopping each other. 5123 and the preliminary positive case stayed together during some period before 2nd of October. But they have no, these 3 cases have no relationship with 5093. So you might have recalled that I mentioned that 5111 had contact with a confirmed case who went back to Thailand. This piece of information is wrong. So we do not know the reason for the a number of cases from the same flight. That's why we evoke our law, Cap 599H, to suspend the airline for 2 weeks, similar to India Airline before.
下一位嗰邊後邊嗰位男士。
So I don't think our transmission has been stopped in Hong Kong. So there's a chance of rebound. Whether you call the rebound a 4th wave or a continuous 3rd wave is, just arbitrary.
嗰位男士後邊位。
你好啊，兩位經濟部。首先都
Economic Journal. I'd like to ask case 5122. She visited a sandwich shop in Kwai Chung. Which shop is it? And did they stay at the premises? And do you need to provide sample bottles for the staff at the sandwich restaurant? And experts are calling for more testing, and they are also calling for 2nd round of testing, a mandatory testing, and they want to postpone the period from 10 days to 13 days. Will you consider this proposal? That is correct. They went to Super Sandwich and stayed and consumed the sandwich at on the premises. So why do we have a postponement from 10 to 12 days? It's because when we don't have lab results and during the quarantine period, they have to have results before they are discharged. And at the time, there were too many cases and there were delays in their lab results. So it might have taken 15 or 16 days. So we need to balance between having the results before completing the quarantine procedures or taking samples later, but having or releasing positive cases into the community too early. So we wanted to have results first. So whether it is 10 days or 13 days, we don't have concrete detail. I don't think it's going to make there's a big difference. Regarding escaped cases, it's hard to say. If you're referring to yesterday's Nepali case, during the testing phase, the patient was not feeling well. They were allowed to contact us, but they did not choose to do so, and they decided to go back home. So patients under quarantine, even if they've taken a sample bottle, even if they don't have positive results, if they feel uncomfortable, they should contact us as soon as possible. That is the whole principle of testing. Now TV. I want to follow up on 5123. That is, they went to Holly Mansion, and then they visited Stanford Hillview Hotel. So has there been a provision of sample bottles for those hotels, or have they stopped accepting hotel tenants? And we have 6 days without of cases where there's an unknown source. So does that mean we're not out of the third phase of outbreak yet? Holly Mansion, we have provided samples for the residents there. The hotel, we have a lot of cases from hotels, and typically we ask the hotel when they did cleaning, were their staff protected? Did they wear PPE? Did they follow procedures? So if they didn't do so, then the cleaning staff might be labeled as close contacts. The hotel will have to clean the specific rooms. If they didn't do a thorough job, then the next tenant will also have to be tested. I mentioned the third wave has not ended, in my opinion. Oriental Daily, today, how many preliminary cases do we have? And I also want to ask the kindergarten parent that lives in Qingyi. We know that some of the children take a school bus. We know there is testing, and if we have preliminary positive results, then will you give the kindergarten samples or help them with disinfection? Now, regarding the Kai Tak construction site, last week there were 2 people who were confirmed. There was a 5-day suspension, and they are back to work today. But we haven't had all the lab results, and some workers are saying they are worried there might be an outbreak. So I want to ask the doctor your view on this. And regarding the bar, case 5107 and the Thai tourist 5198, what are their CT values? And case 5123, Holly Mansion, is it a dormitory or hotel? What kind of premises is that? And lastly, I want to ask about, some experts are saying that the situation is unstable. So having clinics in the 18 districts, can you provide sample bottles? Because we only have 31 outpatient clinics. Could you extend it to all 73 outpatient clinics in Hong Kong where you can provide sample bottles? The preliminary cases today, we have less than 10 cases. The child is not a confirmed case. He's not even a suspected case. And of course, if we have any febrile cases in the quarantine center or a positive test, then we will follow up and we'll trace when was the last day he attended school. So the school might not have to shut down. The Kai Tak construction site, we suggest that they suspend for 14 days. The majority of the samples results, we have negative cases of 400 plus cases, but there were some omissions that have to be retested, and we don't have results yet. We don't have the CT values on hand. Typically, unless there are unusual circumstances, then we will pay attention to their CT values. Now, if they have symptoms, we will consider it transmissible. Holly mentioned it's a unit that one of their friends allowed them to live. Now, in line with the government policy, the HA will arrange for daily for sample bottles in 46 clinics. If people consider themselves high risk, or if they have symptoms, mild symptoms, they can collect samples. So they go back home and provide the saliva samples, and they can hand it back to the next day at designated clinics. So if things work smoothly, we will consider extending the number of GOPC clinics. But the public needs to be aware that they have to return the sample bottle within 3 days for testing. When they submit the bottles, they have to wear a mask, they have to maintain social distancing and wash hands frequently. If we don't have further questions, this will conclude today's press briefing.